Welcome to You're in Good Hands, the podcast where we dive into everything urology. Leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice. All right, so let's dive into something I think is pretty relevant for a lot of men out there.
Okay.
Benign Prostatic Hyperplasia, or BPH.
Right.
Basically, we're talking about an enlarged prostate. And we've got a presentation here from Advanced Urology of Georgia all about a minimally invasive treatment option called Prostate Artery Embolization, or PAE.
PAE.
PAE. And they seem pretty excited about it.
Yeah.
Honestly, after looking through this, I can see why.
I bet.
So if you or someone you know is dealing with BPH, this deep dive might be a real eye-opener.
Yeah, it's definitely a hot topic in urology right now.
Yeah.
What's really fascinating is that PAE tackles the issue from a completely different angle than traditional BPH treatments.
Okay, so riddle me this. How do you shrink an enlarged prostate without actually cutting it out?
Right.
Because that's what PAE is all about, right?
Exactly. The trick is to target the blood supply. Think of it this way. The prostate needs blood to grow just like any other organ. PAE involves injecting tiny particles into the arteries that feed the prostate.
Okay.
These particles block the blood flow, essentially starving the prostate and causing it to shrink.
So it's like turning off the faucet instead of ripping out the whole sink.
Perfect analogy.
I like that one.
And that's why it's called embolization. You're blocking or embolizing those specific arteries.
That makes a lot of sense. Now, the presentation from Advanced Urology of Georgia really emphasizes the minimally invasive aspect of PAE.
Yeah.
They say it typically involves no incisions.
Wow.
Just a small catheter inserted into an artery, usually in the groin or wrist.
Okay.
What does this mean for the patient experience compared to traditional surgery?
Oh, it's night and day, honestly.
Okay.
With PAE, you're talking about a procedure done under local anesthesia, so you're awake but comfortable. Most patients go home the same day.
Wow.
Compare that to surgery, where you're looking at general anesthesia, a hospital stay, and a potentially longer, more painful recovery.
That's a huge difference.
Yeah.
And speaking of differences, the presentation highlights a pretty impressive success rate for PAE.
Oh, yeah?
Something like 70 to 90%. But they're also upfront about the fact that results appear gradually over weeks or even months.
That's a key point to understand.
Yeah.
With PAE, you're not going to see those overnight changes like you might with surgery.
Right.
It takes time for the prostate to shrink after the blood supply is reduced, but for many men, that gradual improvement is well worth the trade-off.
Okay.
Especially considering the lower risk of complications.
So it's about patience and playing the long game.
I like that.
Now let's talk about the benefits that seem to have everyone buzzing.
Okay.
Advanced Urology of Georgia really emphasizes two big ones in their presentation. Preserving sexual function.
Right.
And reducing the risk of incontinence.
Yes.
I mean, let's be real. Those are pretty major concerns for any man facing prostate treatment, right?
Absolutely. These are quality of life issues that can weigh heavily on a man's mind.
Yeah.
And it's where PAE really shines.
Okay.
Because it targets only the blood vessels, it minimizes the risk of damaging the nerves and muscles involved in sexual function and bladder control.
Okay.
Traditional prostate surgery, on the other hand, carries a much higher risk of affecting those areas.
So PAE is like a sniper taking out a specific target, while surgery is more like using a sledgehammer.
That's a vivid way to put it, and it illustrates why PAE is generating so much excitement, especially among men who are looking for a less invasive and potentially less risky approach to treating BPH.
Now, even with all these potential benefits, Advanced Urology of Georgia does acknowledge that PAE isn't a magic bullet.
Right.
They mention that it might not be as effective for very large prostates.
That's true. Prostate size and shape can definitely influence how well PAE works.
Okay.
For extremely large prostates, surgical options might still be the better choice.
Yeah.
But even then, PAE could potentially play a role, perhaps shrinking the prostate enough to make surgery less invasive down the line.
So it's a tool in the toolbox, and sometimes it's the right tool, sometimes it's not. It really depends on the individual situation, right?
Exactly, and that's why it's so important to have a thorough evaluation and a frank discussion with your doctor.
Sure.
Especially one who is experienced with all the available BPH treatment options.
Right.
Like the team at Advanced Urology of Georgia.
Yeah.
They can help you weigh the pros and cons and figure out what makes the most sense for you.
Speaking of comparing options,
Yes.
this presentation has a handy table that pits PAE against other common BPH treatments.
Okay.
It's like a BPH showdown.
It's a great visual for seeing how the different approaches stack up in
Yeah.
terms of effectiveness, recovery time, risks, and so on.
Okay, let's walk our listener through some of the key takeaways from this comparison table.
All right.
First up, we've got PAE versus the heavy hitters,
Okay.
TURP and HULEP.
Right.
These are surgical procedures, and as we've discussed, they tend to be more invasive than PAE.
Mm-hmm.
So what are the main differences that jump out at you?
Well, as we've already touched on, recovery time is a big one.
Okay.
PAE boasts a significantly faster recovery compared to both TURP and HULEP.
Got it.
We're talking about going home the same day versus a hospital stay and potentially weeks of recovery. And it's not just about the length of recovery, but also the potential for complication. PAE generally has a lower risk profile compared to those surgical procedures.
That's a big deal. No one wants to trade one set of problems for another.
Exactly. Now, it's important to note that TURP, which stands for transurethral resection of the prostate,
Right.
and HULEP, which is holmium laser enucleation of the prostate,
Okay.
they are often more effective for larger prostates than PAE.
So there's that trade-off. Again, less invasive, but maybe not as effective for those really large prostates.
Right.
Got it. What about UroLift? The presentation mentions that as well.
Okay.
It's another minimally invasive option, right?
Yeah, UroLift is gaining popularity, and for good reason.
Yeah.
It's a really interesting procedure where they use tiny implants to lift and hold the prostate tissue out of the way, widening the urethra.
So instead of shrinking the prostate, they're just kind of propping it open.
Exactly. It's a clever approach.
Yeah.
And it can be quite effective, especially for smaller prostates.
Right.
But just like with PAE, it's not a perfect solution for everyone.
Okay, so we've got this whole spectrum of BPH treatments, each with its own pros and cons.
Right.
It really highlights what we talked about earlier, the importance of personalized medicine, right?
Absolutely. There's no one-size-fits-all answer when it comes to BPH treatment.
Yeah.
It's about finding the best fit for each individual based on their specific situation, their prostate size, their overall health, and their personal preferences.
And that's where having a skilled and experienced healthcare team comes in.
Yes.
I mean, it can feel overwhelming to navigate all these options on your own.
For sure. You want a team that will take the time to listen to you, answer your questions, and guide you through the decision-making process.
And it sounds like Advanced Urology of Georgia is really focused on that patient-centered approach.
Yeah.
They talk a lot about their commitment to providing a positive experience and achieving the best possible outcomes for their patients.
Yeah, and they highlight their team of highly experienced interventional radiologists,
Right?
which is key when you're talking about a procedure like PAE that requires such precision and expertise.
Totally. Now let's shift gears a bit
Okay.
and dive into the nitty-gritty of the PAE procedure itself.
All right.
The presentation from Advanced Urology of Georgia actually walks us through it step by step.
It's pretty fascinating, even for someone like me who's seen it countless times.
All right, so first things first, they emphasize that PAE is done under local anesthesia.
Right.
That means you're awake, but you shouldn't feel any pain, right?
Correct. You'll be given medication to help you relax and make sure you're comfortable throughout the procedure.
Got it. Then they insert a small catheter into an artery, usually in the groin or wrist.
Okay.
Why those spots? Is it just because they're easy to access?
There's a bit more to it than that. Those arteries provide a relatively straight pathway to the prostate arteries, making it easier for the interventional radiologist to navigate the catheter with precision.
Gotcha.
It's all about getting those tiny particles to exactly the right spot.
Precision is key. So the catheter is in place. What happens next?
Okay.
This is where the pancake happens.
Exactly. Now, they inject these microscopic spheres called embolic particles through the catheter.
Okay.
These particles flow through the bloodstream until they reach the targeted arteries that supply blood to the prostate, and then boom, they block those arteries off.
So it's like setting up a roadblock in the prostate's blood supply.
Love the analogy.
I'll try.
And by cutting off that blood flow, you trigger a natural shrinking process in the prostate.
It's amazing how such a tiny intervention can have such a big impact.
It is.
The presentation mentions that the procedure typically takes 1 to 2 hours. What's going on during that time? Are we just hanging out watching those particles do their thing?
It's definitely not a passive process. The interventional radiologist is actively guiding the catheter and monitoring the injection of those embolic particles. Using real-time imaging, usually X-ray fluoroscopy, they're making sure those particles are placed precisely and that the right blood vessels are being blocked. It's very meticulous work.
So it's not like about knowing where to inject. It's also about knowing how much to inject, right?
Exactly.
Too much, too little, it could affect the outcome.
Exactly. It's a delicate balance, and it really highlights the importance of experience and expertise. The team at Advanced Urology of Georgia has performed countless PAE procedures.
Yeah.
So they've really honed their skills in this area.
That's reassuring to hear. Now let's fast forward a bit.
Okay.
What happens after the procedure?
Right.
The presentation makes it sound pretty straightforward. Go home the same day, some mild discomfort for a few days, and then gradual improvement in symptoms over the coming weeks.
That's the general idea. Of course, every individual is different.
Yeah.
And your doctor will give you personalized instructions for your recovery, but overall, the goal is to minimize any disruption to your daily life.
Which is a huge plus compared to traditional surgery, right? No extended hospital stay, no big incision to heal from.
Absolutely. PAE allows men to get back to their routines much faster with a lower risk of complications.
So it's gentler on the body, but what about the long-term results?
Right.
We talked earlier about how PAE doesn't completely remove the prostate tissue like some surgeries do. Does that mean the benefits are only temporary?
That's a common question, and it's understandable.
Yeah.
While it's true that PAE doesn't involve actually removing prostate tissue, the effects can be remarkably long-lasting for many men.
Okay.
Studies have shown that significant symptom relief can persist for several years after PAE.
Okay, that's good to know. But what if down the line those symptoms start to creep back? Is a repeat PAE an option?
Yes, in some cases, a repeat procedure might be necessary after several years.
Got it.
But even then, it's still a much less invasive option than going through another surgery.
Got it. So it might not be a one-and-done solution for everyone.
Right.
But it offers a way to manage BPH symptoms with minimal disruption and risk.
Exactly. And it gives men more choices, empowering them to make informed decisions about their health.
Which brings us back to that thought-provoking question you posed earlier.
Oh, yeah.
What other areas of healthcare could benefit from this kind of deep dive approach where patients are armed with knowledge and options?
It's a question worth pondering, isn't it? Imagine a healthcare system where every decision is made with this level of information transparency and shared decision-making between patient and doctor.
Yeah.
It's a vision worth striving for, and PAE is a great example of how we're moving in that direction. But before we get too philosophical...
Oh, come on. You're going to leave us hanging again.
Don't worry, we'll be back shortly to wrap up our PAE deep dive with some final thoughts and takeaways. Stay tuned.
Okay, and we're back for the final stretch of our deep dive into prostate artery embolization.
Right.
We've really explored, I think, the ins and outs of this procedure, how it works, the potential benefits, the risks, and how it stacks up against other BPH treatment options.
Yeah, we've even ventured into some broader territory, like
Gosh.
the importance of personalized medicine and patient empowerment.
Right, because at the end of the day, it's not just about understanding the science.
Right.
It's about making informed decisions that align with your individual needs and values.
Exactly.
And honestly, that's where having a healthcare team that gets it, that truly listens and guides, you can make all the difference.
Absolutely. Finding a team that prioritizes your experience, that's committed to achieving the best possible outcomes for you, that's key.
And it seems like that's exactly what Advanced Urology of Georgia is all about.
Yeah.
They really seem to put the patient at the center of everything they do.
Yeah, their presentation really highlights their focus on patient experience and outcomes. And they've got this state-of-the-art facility specifically for PAE.
Wow.
Which says a lot about their commitment to this procedure.
It's like they've built this haven for men seeking a minimally invasive solution to BPH.
Yeah, and their team of highly experienced interventional radiologists is another big plus.
Right.
That level of expertise is crucial when you're dealing with a procedure that requires such precision.
Okay, so as we wrap up this deep dive, let's distill some key takeaways for our listeners.
All right.
First and foremost, PAE is a game changer for men with BPH.
Yeah.
It offers a minimally invasive alternative to traditional surgery, and it's got some impressive advantages.
Right. It works by blocking the blood vessels that feed the prostate, causing it to shrink and relieve those frustrating urinary symptoms. And it's got a pretty high success rate. Studies have shown that 70 to 90% of men experience significant improvement after PAE.
And the recovery time is remarkably quick. We're talking about going home the same day in most cases,
Right.
versus a hospital stay and weeks of recovery with surgery,
Yeah.
plus the risk of complications like sexual dysfunction and incontinence. Those big concerns for a lot of men are significantly lower with PAE.
That's a big deal, but we also have to acknowledge that PAE isn't a magic bullet.
Right.
It might not be the best option for everyone, especially men with very large prostates.
Right. It's not one size fits all.
Yeah,
And that's why it's so crucial to have an open and honest conversation with your doctor.
for sure.
They can help you weigh the pros and cons of PAE, compare it to other options like TURP HOLIP or UroLift, and figure out what makes the most sense for your unique situation.
And if you're leaning towards PAE Advanced Urology of Georgia, seems like a top-notch place to explore that option.
Yeah.
Their expertise, their patient-centered approach, their state-of-the-art facilities,
Mm-hmm.
it all adds up to a really compelling choice for men seeking relief from BPH.
Couldn't agree more now before we sign off.
Okay.
I want to circle back to that thought-provoking question you posed earlier.
Mm-hmm.
You ask our listeners to imagine a healthcare system where all decisions are made with the same level of information and choice that they've explored with PAE.
Right.
It's a pretty powerful idea, right?
It really is. What if this kind of deep dive approach where patients are empowered to understand their conditions, explore their options, and actively participate in their healthcare decisions?
Mm-hmm.
What if that became the norm across all areas of healthcare?
It's a vision worth striving for.
Yeah.
And it all starts with being curious, asking questions, seeking knowledge, and advocating for ourselves.
And remember, you don't have to do it alone.
Yeah.
There are resources out there, healthcare professionals who are passionate about patient education, and communities like ours, where you can connect with others, share experiences, and learn from each other.
So true. We hope this deep dive has not only informed you about PAE, but also inspired you to take a more active role in your health journey.
Right.
Knowledge is power. And when you combine that knowledge with a compassionate and supportive healthcare team, you can achieve amazing things.
Keep asking questions, keep learning, and keep advocating for your well-being.
Thanks for joining us on this deep dive.
Thanks, everyone.
We'll catch you next time. If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.